Thank you. Good afternoon. So I have just a couple of announcements. First, I want to welcome all the guests who are here today to visit the League of Women Voters in Action. We have a program every month. We can put you on our mailing list. You can watch the community calendar. We usually meet on the third Thursday. So this month we thought that was a little too close to when the ballots were due. So we moved our program up a week, and I appreciate Valley River's cooperation and ability to change. So a couple of announcements. If you bought fruit and made a donation to Food for Lane County during the League's fruit sale, your donation receipt letters are in the back with Marge Maxwell. So they're in the file bin over there on the corner of the table. So if you pick yours up, we won't buy stamps for them. The other thing is, I have a note from Senator Wyden's office that he's holding his first Lane County Town Hall of 2018 tomorrow evening, 5:30 p.m. at LCC, the main campus of LCC, and you can reserve a seat by calling Senator Wyden's office. On Monday, Martin Luther King Day, there is a walk from Autzen Stadium to the Shedd Institute downtown. And you can park in the Surbu parking lot, meet at the north gate of Autzen Stadium, and there will be shuttles back to the parking lot. So I don't think I introduced myself. I'm Linda Lynch, and I'm president of the League of Women Voters of Lane County. And just for our guests especially, the League works to encourage informed and active participation in government and to influence public policy through education and advocacy. When we research issues, we always seek input on all sides of an issue. We originally planned this event as a yes-no forum, so you'd hear a speaker from the Yes on 101 and a speaker from No on 101. But in changing from the third Thursday to the second Thursday, we've run into the legislature meeting in committee meetings, legislative days in Salem. And the opponents of Measure 101 are led by 3 legislators who succeeded in referring the measure to the ballot and were unavailable, and the No on 101 campaign did not provide a speaker for us. So our discussions this month, and especially during this past week when we've met in small groups to talk about this measure, I feel have opened a window just a little bit. And we've looked in and found an amazing world of healthcare finance complexity. And that this one question has made us look at all of those things. We've tried to become our most informed selves on this one ballot question for this month's special election, Ballot Measure 101. The measure asks us to approve or to ratify the legislature's plan to finance Medicaid, in particular to cover the people who became covered as a result of the Affordable Care Act. The question is on the ballot because as I said, because 3 state representatives secured enough signatures to require the state to put the question before voters. You must vote yes to keep the plan the legislature approved, and you would vote no to overturn it. So we understand that much, but we find ourselves wondering about the system as a whole. Generally, not 100%, but generally, I don't think that we're all the experts on Medicaid and who's covered and what we would get. So today's speakers are going to explain all of this to us. Our first speaker is going to be Josh Ballack. He's an expert on the Medicaid system, how it works, who gets what, and even more than that. Josh is Vice President for Government Relations and Health Policy at All Care Health in Josephine County. Yes, he drove here from Grants Pass. All Care is a physician-led community care organization that works to make healthcare simpler and better for the people of Southern Oregon. It's headquartered in Grants Pass, offers a wide range of health plans and services designed to meet the needs of diverse communities while controlling costs for both patients and taxpayers. After Josh explains the Medicaid system, Former State Representative Val Hoyle is here, and she will speak about Measure 101. Val has participated in developing healthcare policy at many levels. She was director of the 100% Access Initiative for United Way of Lane County. She represented West Eugene and Junction City in the state legislature for 7 years. During that time, she chaired the Committee on Healthcare and worked on the framework for what has evolved into Measure 101 today. And there will be time for questions after their presentations. So Josh, you're up.
All right, let's hope this works. Hi, everybody. My name is Josh Palick. I'm the Vice President of Government Affairs and Health Policy for All Care Health. Thank you for the introduction, and I just want to say how honored I am to be able to speak in front of you. The League of Women Voters has a very special place in my life. My grandmother and my mother were both members for actually many, many years, so thank you for all that you've done in encouraging people to be civically engaged. So just want to say that, and I don't want to make that noise. Okay, good, it's working. So a little bit about me. I grew up in Newport, Oregon. I went to Oregon State University, so it's okay. My brother's a duck, so it's all right. I worked in political campaigns for quite some time. My last capital job, I worked for State Treasurer Ben Westland until he passed away in 2010. And I needed a job and ended up accidentally becoming a lobbyist. And just happened to be there when they were starting the coordinated care model and the coordinated care organizations, and was part of the kind of negotiations around that, and for the next few years really was involved in helping get those things set up. And then as time went along, I got to know a lot of CCOs, and All Care was looking for some help, and they were just this really innovative, forward-thinking organization that literally was leading the state while the state was leading the country, and I was like, I want to be a part of that. So I convinced my wife and my daughters to move to Grants Pass, and so we moved there. So many of you may know Senator Dr. Alan Bates. He was a very, very good friend of mine. He actually wrote this. This was the enabling legislation for the CCOs, and 2 years ago on Sunday, he actually gave me that. So on my 38th birthday, so Sunday is my 40th. So he was the godfather of CCOs. And he used to always say that if the CCOs are done right, they will be the greatest anti-poverty program that this country's ever known. And I actually spoke to him. He said that to me 2 days before he passed away. I went over to his house, was hanging out with him, and he needed some help with a letter. And so I wrote that note and found out 2 days later he had passed away. So that sits there on my desk still this day to remind me I've got something to do for Doc, to make sure that we're getting the CCOs right and that we're really improving the health care, not only for folks on Medicaid, but everybody. So what exactly is the Oregon Health Plan? So who's covered? So all adult Oregonians making 138% of poverty and below, they are covered. Pregnant moms, Oregon children with 300% of poverty if their parents aren't covered already, children in foster care, and severely disabled and seniors under the poverty level. And then there's also a bunch of other buckets and things like that too, but that's basically who's covered. So what exactly does the Oregon Health Plan cover? So we do physical health treatments that are above what's known as a prioritized list. So these are evidence-based things that we, as the state, have taken a look at and say this works the best to be able to deliver health care for the folks. We cover pharmaceuticals. Not all states do that. I actually just found out the other day. Mental health care we cover. Dental care we cover. Vision for 21 and younger and pregnant moms. And non-emergent medical transportation. So that's basically making sure people are able to get to the doctor, which in a community like ours, well, heck, Lane County, I mean, trying to get from Oak Ridge out to down to Eugene, that's a heavy feat. So we actually offer that transportation to be able to get to and from. And then some flexible services. So we'll talk a little bit about that here in a sec. So what exactly was the CCO? So pre-CCO, there was physical, mental, and dental, and they were all siloed. So you can imagine trying to navigate that type of thing, especially if you're sick. I mean, it's, you're dealing with some dental pain while trying to get physical health care, while trying to get non-emergent or transportation set up. That's almost impossible. That was the system. And by the way, none of those guys talked to each other. So what we did was we changed the model to essentially say the member's in the center. We're going to wrap primary care, but it doesn't even have to be primary care. It can be a dentist, it can be a mental health professional. It doesn't matter. There'll be that point of contact, and then we as the CCO will build all of those other things around them so that they do it. And I used to say, I remember coming out of the session in 2012, people were like, are these CCOs actually going to work? And I said, or what would it look like when they work? And I said, well, this is the way it should look for a member. All they know is that their doctor seems to know a lot more people, and they can get in to see a lot more people faster. And that's exactly what's happened. So we have, so what are the successes? We have 95% of all Oregonians covered. It's amazing. 100% of kids. That is something we as Oregonians should be really proud of. Increase the prenatal checks from 70% to 94%. If you had told OBGYNs that we would increase that number that high, they would have looked at you like you were crazy. We did that in 5 years. It's amazing. Emergency room department visits have dropped 23% statewide. Huge reduction in charity care for hospitals. Investments in programs to improve the community health. So a good example of that is we've been helping get access to homes for our members, because as it turns out, if you have diabetes, it's really hard to manage if you're homeless. So we've started to invest in those types of things. We've helped foster kids by getting them to camps and things like that, because if you're destabilized, but to go to an actual youth camp, you actually get to hang out with kids and build relationships and build trust. Those are the types of programs that we're funding. Or in one case, we handed out masks during the whole smoke stuff. I mean, you guys got hit just as hard as we did down there, but we had 18 straight days of bad air quality, so All Care provided masks. And I don't need a waiver. Those are my kids, so it's okay for me to do that. Oh, and by the way, during all of that, we have increased all these qualities. We have already saved the federal government $1.3 billion, and we're expected to save them another $1.9 over the next 2 years. I call that a success. So does this baby. So what does that actually look like on the ground? This is a nurse practitioner. Her name's Lisa Callahan. She's a pediatric nurse practitioner in Grants Pass. She said that when I was talking to her the other day, 90% of her kids are on Medicaid, who she sees. And she had a story that I thought illustrated exactly how important healthcare is to families, not just kids, not just adults, but families. So she had a mom who was pregnant. She was covered by OHP at that time, and she developed gestational diabetes. But the diabetes stuck around, but her health coverage didn't, because she was making too much money. So as a result, she wasn't able to get her insulin. She wasn't able to manage it. As a result, also, the kid wasn't able to get in and see Lisa because the mom was struggling so much. Well, when the expansion population came along, the mom got coverage. She got her diabetes covered. And not only was she doing better, but she was bringing her daughter in more and more so that she was doing better. So it really is. This isn't about just adults or kind of these one-offs. These are about helping families. So, and I think that that's a really different way to look at things and a really important way. So I'm going to talk just really quickly about what happened in 2017, how we ended up getting there, and what the frame was. So there was a $900 million hole inside the Oregon Health Plan budget, and a little bit of it was known, but most of it wasn't. So 250 million of it came from, I'm going to start to nerd out here, so I apologize. 250 million of the whole came because of the payer mix. So in essence, the way it works is from 0 to 100% of poverty, anybody who makes that, the federal government pays 65 cents of the price tag of care. Oregon comes up with 35 cents. For the expansion population, starting in 2017, the feds pay 95 cents on the dollar. We pay 5 cents. What happened over the last couple years is, as the economy's gotten better and things are going, from those people making 100 to 138% of poverty, where we were getting really high reimbursement, they were getting jobs and getting out of Medicaid. But the people that we were getting the low reimbursement, they didn't change. They actually started to increase a little bit. So as a result, that created a $250 million hole. The other problem that we had, maybe, oh, dang it, sorry. The other problem that we had was there was a $300 million hole that happened once the federal government essentially said, hey, we're going to help you with the expansion population, but we want the states to kick in a little bit more. They decreased the amount of money they were going to fund us. That was $300 million. The big one, and this was the unprecedented one that we weren't expecting, is they dropped our reimbursement from 65% for the standard population down to 63%. That created a $350 million hole. And the reason they did that is Oregon was deemed a highly performing economic state. So I don't know about Lane County, but I can say down in our neck of the woods, we didn't see that. And unfortunately, the only county which actually drove the entire increase was one county, Washington County. Washington County, yep. Until all of the stuff that was going on there. So unfortunately, because of that, we ended up getting cut. So that's what created that hole. It wasn't mismanagement. There weren't bad things going on. It just was kind of a series of unfortunate events in the funding structure. So we came up with a plan to be able to try to address these issues on a myriad of different places. And I'm going to show you exactly basically what we did here really quick. So this is a crazy flow chart, but I promise it will make sense once I'm done. So this is what the current hospital provider tax is. So right now, we take 5.3% of their revenues, and the state collects it. With 4.5% of the revenues, that goes over to the federal government. For every dollar we send the feds, they send us 4 back. It's a good deal. And before you get worried about it, 49 states use a very similar mechanism as this. So and the 50th is Alaska, and they've got an even crazier thing that they do. So the money comes back. We then take the original tax dollar, we send it back to the hospital. Then with the matching dollars, we give that to pay for the Oregon Health Plan. So that pays for prescriptions and primary care and vision and all of those things, and increased reimbursements for the hospitals. Not only was that going on, the hospitals were also taking 0.8% of their money. They would then give $1, we get 4 back, and then they would take the match and the original money. So really, really good deal for the hospitals, and it was a really good deal for the state of Oregon. It was a great way to be able to leverage money back into the state. And I think what's really important to remember is Oregon is still a donor state, which means we spend more money to the feds than they send back to us. So this was a way to get our tax dollars back into the state of Oregon. So what did we do? We got rid of the red part. We increased the number to 6%, and instead of sending every single dollar back to the hospital that they taxed, we only send 5.3% of their money back. They still get the increased reimbursement side of stuff, which is good, but it's a little bit of a cut. That's all we did. So then how do the premium taxes work? So that was the other addition. This helped raise some money. So the way to look at this is the CCOs originally, or they were called MCOs at the time, they originally were getting taxed. They changed the rules at the federal level, and it's not a tax, it's an assessment. They changed the rules, and they said if you want to continue doing this, you have to do the commercial insurance plans too. And so we had opted out of it, but then we tried to restart it. So then what we ended up doing was we took the match, we ran it through, $1 became $3. We then take the CCOs get a little more extra money to be able to pay for the assessment, and then we take the match money that helps CCOs. Then for the commercial insurance side, we take that, we run that through, $1 becomes $3. We then take the match money and 25 cents of the original tax, give that to stabilize Medicaid. So wait, there's more. So the 75 cents of the original tax then goes in to pay for what's known as reinsurance. So the way to think about reinsurance is it's insurance for insurance. And a good example is like a hemophiliac. So if you're a hemophiliac, it means you can't clot. They're about $1 million a year to treat. And so because we have no pre-existing conditions, which is great, insurance companies are always very worried about them showing up. So they buy this thing called reinsurance, and reinsurance says, you, insurance company, pay the first $500,000. Anything after that, we'll pick up. That's all this is. So what we did was we put that into a reinsurance program for folks on the exchange. So these are people who buy like basically independent business people, stuff along those lines. They end up getting the insurance. We then were able to leverage another $49 million into the program from the feds. And then we were able to, because we were buying that reinsurance, drop people buying the insurance exchange 6%. It's a big deal. So, and I know that there's been increases inside of what's been going on, but just imagine this. If this fails, all of those folks are going to see a 6% increase on top of what they've seen. So it's a really, really big deal. And then they're able to basically get their money back. So that's essentially how that looping mechanism works. So the one other thing that I do want to kind of point out here, and it's really important to understand the budget stuff. So basically this is about 17% of our total budget. That's over a biennium in the way that everything is broken up. But CCOs have already signed their contracts for 18, which means all of the cuts will end up in 1 year over a biennium, which means that 17% cut, if we just take it straight on, will actually be a 34% cut. And that means all of those services that you saw all start to really get in jeopardy because you really only have two options. You start cutting services or you start cutting people off the plan. And one of the things that happens is that if we do this and we are forced to start cutting people off the plan, we've got to go and negotiate with the federal government to change our waiver again. And I don't know about you, but I do not look forward to negotiating with the federal government at any level right now. So, you know, and the other important piece here is if we start kicking people off of the plan, that is going to have a huge impact on all of our premiums, because what you're going to see are people no longer getting health insurance. They won't go in for preventative care. They'll wait until they end up getting really sick. They'll end up in the hospital, and that will end up being deemed charity care. But there is no such thing as charity care. We will all pay for that in our rates going forward. So not only are we going to end up having significantly higher rate increases in the years to come, but we're going to have a sicker population, and we're going to destabilize the Medicaid population all at once. So with that, I think I'm just going to kind of stop there and let Representative Hoyle, or the Honorable Val Hoyle, go. So, all right, I think we'll do questions afterward, if that's okay. Do you have
So that was a fantastic introduction of the details of why Measure 101 is so very important. So I want to thank the League for having us here today. This is such an important issue, and it is a January election, and there are not a lot of people that vote in a January election, except the people that are out voting right now are the ones that are saying, we don't want new taxes, because somehow the people that have put Measure 101 on the ballot have said this is a new tax, and if this $1.3 billion is taken out of our budget, nobody's going to lose coverage. So that's what you're going to hear the opposition say. I'm here today, as you all know, I'm a former representative from West Eugene, Junction City, and I'm formerly the director of the 100% Access Coalition at the United Way of Lane County, where we work to provide affordable, accessible, appropriate health care to people in Lane County previous to the Affordable Care Act. Remember that previous to the Affordable Care Act, 21% of Lane County residents were uninsured. And we are now at, I think, 5% or less, 5%. So 21 to 5%. That's what we've done since the expansion of the Affordable Care Act and the CCO model. So I'm also here representing over 160 organizations. Every single healthcare organization in the state, every single children's advocacy organization in the state supports Measure 101. Disability Rights Oregon, the hospitals, insurance companies, doctors, nurses, firefighters, those people that care most about the safety net support Measure 101. The opponents will say, well, these are just special interests. But I'll tell you, you know, being in the field, working with people who don't have insurance, who don't have coverage, who don't have access to care, those special interests are exactly the ones I want to be listening to. The doctors, the nurses, the people at Occupy Medical. Those are the people that support 101. So we also, this proposal that's put together, that Josh explained so well, was put together in a bipartisan manner in the legislature. So in the voters pamphlet statement, you will see that Senator Ted Ferrioli, who's a Republican from Eastern Oregon, and Peter Courtney, Democrat from Salem, from the Salem area, together wrote a voters pamphlet statement on why they support 101. Senator Jackie Winters, Senator Alan DeBoer, Republican from Southern Oregon, said that without this, our state will be in real trouble. And he's right. I agree with them. So Yes on 101 is the broadest coalition that I have ever worked with. And there's a reason for that, because it really is critical, and it's going to be tough to pass it. But we have to come together because everyone deserves health care. And Measure 101 will make sure that we don't have to cut services. And the fact of the matter is, I think that we need to do more. But we have done a darn good job in Oregon, and I think we don't hear enough about the good work that's happening here. You can clap at that. You know why? Because that's a good thing. So 1 in 4 Oregonians are on the Oregon Health Plan, including 400,000 children. And so I think, I have this whole speech, but what I'm going to say to you is, because Josh took all my words. Thanks, Josh. So we can get to questions quicker. Let's see. Yeah, I guess all I'm going to say is we'll spend the rest of the time answering questions, and just say that a no vote will send us back to the time where people who were very, very sick and couldn't afford coverage were on a lottery system. Do you remember that in 2003, when people were on a lottery and they had to hope that they could get coverage to get the care that they needed? I had a constituent, his name was Pat. He was a 38-year-old investment banker, had money, a house, marriage, everything he could want. He had a stroke and lost all of that. Lost his home, his savings, his wife, his job. And he was able to get the care that he needed because of the Oregon Health Plan. Can you imagine looking at somebody who's had a stroke, who needs the kind of care that will allow him to become a productive citizen again, and say, I'm sorry, we didn't pick your name in the lottery? Well, that's what happened before. We didn't provide dental care that is so critical. That's one of the first things on the chopping block. Not because we want to cut it, but because when you take $1.3 billion out of the budget, and again, that's $330,000 from the state of Oregon, that matches over $700,000 federal dollars that we paid to Washington, D.C., that we're getting back here, as opposed to sending to Arkansas or Florida or somewhere else. Why shouldn't those dollars come back? So again, we'll answer questions, but in the end, what I would say is, if you haven't done phone banks or knocked on doors or talked to your neighbors or gotten your ballot in, I would implore you to do so. I am very, very concerned that people are like, well, I don't quite understand it. I think health care is good, but it's January. It's the kind of election that the people are coming out are the people that say no, so our voices need to be heard more. And with that, we will answer any questions that you have. Yeah.
So I know we have a lot of guests, so what I want to know before we start individual questions is, do people really now have an understanding of what the ballot question asks you? So, are you ready? So do you feel like, I know what it is now and I'm ready to vote? So, well, I was going to ask Val to tell you that you're being, what it is you're being asked to vote on. And then we'll send a microphone around the room, okay?
So what you're being asked to vote on, Measure 101, according to the official ballot title, approves temporary assessment to fund health care for low-income individuals and families to stabilize health insurance premiums, temporary assessments on insurance companies, some hospitals, and other providers of insurance or health care coverage. My email address.
I'll be quick.
Oh, yeah, sorry.
I did have a detailed question that would help maybe people understand. When you talk about the federal poverty level, how much annual income is that?
I believe it's around $34,000 for a family of four.
For a family of four,
Four.
about 34,000.
Yeah.
Below that is below the federal
Yeah.
poverty level.
Yeah.
Okay.
Yeah. Okay. Yeah. Sorry.
Okay, Val, I
Yep.
would really like to get to the bottom of this argument in opposition, page 43 of the voters pamphlet submitted by Saul Esquivel. He's stating that the Oregon Health Plan would provide coverage for children of undocumented immigrants. I've been to the website, and I know that it states very specifically that Medicaid does not offer benefits to undocumented aliens. What about the children of undocumented aliens, immigrants?
Undocumented immigrants. So, you know a little more about eligibility.
So in this last session, we expanded. So we had a program called CALM, and I don't remember what it stood for. But in essence, if you were a pregnant mom in the country, undocumented, we still wanted to make sure that you were getting prenatal care and make sure that you were getting taken care of. We expanded that program out to include kids up to 18. So it was called the Cover All Kids Initiative. So that's how we got to that 100% number that was up there. It is not Medicaid dollars, and there aren't necessarily any federal matching funds other than for like very specific things inside of for pregnant moms. So that's what we end up doing. So it's not Medicaid, and if this votes no, that doesn't defund that particular thing.
So I think that's a critical piece, is that we did vote on Cover All Kids, and I think my good friend Vic Gilliam, it was one of the most moving speeches I've heard. Vic Gilliam, Republican from Silverton, talked about how for him, as a Christian, his values are, that we as a state, we take care of our children, and so there are dollars, but we don't use federal dollars or Medicaid dollars for undocumented children, but there are other funds that are set aside for that. That is a great question.
Thank you for clearing that up.
Sure.
I have a question.
Yeah, kind of. I can kind of hear you.
Hello?
Yep, can hear you now.
Oh, okay. Lou Siniger from Healthcare for All Oregon. I have a particular question about Medicaid. Is it true that a person has to lose their house or cannot own a home to be on Medicaid?
No.
You can own your own home?
Yes.
Okay, thank you.
I want to take a thing here. I think that this is really important. That expansion population, it really collected a lot of families that were working, who were doing all the right things, usually young families. This is coverage for our friends, our neighbors, the people that you interact with on a day-to-day basis. And I think that that's a really important thing. I mean, right now, 10% of Lane County gets their health care from just the expansion population, and that's the thing that's most at risk. So these really are probably people and they're living their lives. They've got houses and mortgages and everything else, but they're just barely making it by. And if we pull out their health care coverage underneath of them, they're going to have to really be making really bad decisions, not only for their financial future, but also for their health and the health of their family.
And again, I would just go back to when we didn't have access to dental care on OHP. We had people, it was 3.5% of emergency room visits were for dental care. I had a constituent who was this older man, hardworking farmer, and he was going to coastal farms to get animal antibiotics because that's what he could afford to take care of the infection in his mouth because he couldn't afford to go to a dentist. That's wrong. And so what we did was we worked with the Lane County Dental Society and LCC, and we put together free dental clinics. And with this expansion population and the money we've had, we've been able to add dental care because, as you know, if you don't have your back teeth, you're not going to be able to eat well. If you don't have your front teeth, you're not going to be able to get a job, right? So there's some key things that are really, really important. So that's just, Yeah, want to make those points. And when people can't get that care, we all pay for it in higher emergency room visits and in, uncovered care.
I have a question. I have heard several people who oppose the measure, I oppose it, yes, talk about how the assessment will harm school districts. And I want to have some discussion about that. Health clinics in schools, do they get reimbursed through insurance? Well, anyway, I'd like some discussion of that to clarify that, because that's one of the arguments that many people use, is that we're hurting children by providing health care. Anyway.
Do you want to start that?
Yeah, the last bit of it was probably exactly right. I have a lot of folks who who've worked in the schools, and we actually at AllCare have been very intimately involved in trying to link up health to health care into the schools, because they're a captive audience. It's a good place to be able to educate folks and to be able to engage in those types of things preventatively. One of the main drivers of this is of school problems is absenteeism, and usually that is driven by people who are kids who are sick, or more importantly, their parents who are sick. So first and foremost, if you want to be able to help school kids, make sure they've got health care. Secondly, if you look into the actual funding mechanism of all of these things, I want to go back to my final point that was there. If we end up kicking people off of health care, they will end up exercising the emergency rooms, and we will all see massive increases in our rates. So is there a little bit of a bump on that side? I mean, and it's very minute, 1.5% is not a huge increase in comparison to what it could be. Then it's a well worthwhile investment, because at the end of the day, we're going to pay for the health care. Do we want to pay for it preventatively, or do we want to pay for it when people are suffering from chronic illness? And that's really what this is about.
I understand that. What I'm wondering is that there is an assessment to school districts, and how this is going to affect schools.
It's an assessment so they are part of the commercial insurance part of that. There is, yes.
So, and I think the way I would say it is, there is an assessment. The insurance companies came and said, and the hospitals said, please assess us this extra money so we can get this matching dollars for the hospitals and expand care. And the insurance company said, please assess us, because part of that money will go into the reinsurance program, and the reinsurance program allows them to drive down costs, because they're not having to take the cost of the people who are really, really, really expensive, right? Before, when you could block someone from getting care because of pre-existing conditions, insurance companies could sort of pick and choose. Fortunately, we're not there anymore. And again, we have these reinsurance programs. So yes, there is an assessment, and what we have shown is that that assessment and the reinsurance program drives down costs by 6%, saving an average of $300 per insured person. So it's not auditor, what do you call it? What our analysts, the insurance analysts have said, and the financial analysts, the independent analysts we've spoke to have said that we should see a 6% reduction in those commercial insurance plans, so $300 per person. So it's kind of the opposite.
As a longtime advocate for single-payer health care, I'm very concerned about the huge increase in the number of homeless also. I know St. Vinny's Family Center has had a doubling this last year in the number of homeless families. And I don't know how it relates to health care costs for that instance, but I know that 75% of those who lose their health care, who lose their homes, lose it because of health care costs. And I don't think this is recognized. I was wondering if it's gone up this last year because of the increase in homelessness, the cost. Would anyone know the total cost?
I don't know the correlation. I know that previous to the Affordable Care Act, I do know that over 50% of bankruptcies were because of health care costs. We've been able to lower that number considerably which is really the point. And I'll have to say, my mother, who had a house, had retirement, had retired, and had lost her job because her job got outsourced, had a very bad fall and didn't have insurance at that time. She was an independent contractor and her job got outsourced, and she lost her home. She lost her retirement. Because she had to have multiple surgeries. She broke her leg very, very badly just in this random fall, and had to go back to work. In her, she was, so I think she was 61, 62, but she lost everything that she had put aside. And those are the kind of things that a basic health care coverage system will prevent, and it is critical. But you're right, if you're living in your car, it's really hard to manage your chronic disease, whether it's diabetes or asthma. We see some of our little kiddos out in Bethel, that have been able to come to school and have less absenteeism because we have a school-based health clinic. School-based health clinics are funded separately, but again, what we've been doing with our school-based health clinics, who used to not charge and not bill insurance, they are now being able to bill so that they can get money back in so they can cover more kids. And we have seen, like in Bethel, where we have 9% of our kiddos are homeless, that they're able to come to school and they're able to get health care, they're able to manage their chronic diseases, all because they can get care in schools.
And actually, thank you for that question. I think the connection between homelessness and health is a vital piece of what we need to be able to address. And one of the great things is the CCOs have been engaged inside of trying to make that happen. One of the things we've done at All Care is we've actually hired analysts to say, if we get housing, how much will we save? And so the thing that I showed up there, Hope Village, we have members, I think about 75, that we help get housing there, pay for rental assistance, make sure that there's wraparound services there. And we have seen an average of $1,000 reduction a month in their medical costs. So we're able to actually make that type of thing. Now, what's really important, though, is that's based on the coordinated care model. And it's these type of flexible services, this kind of creative things, they're the first thing that has to get cut, because that's what is at jeopardy. It's going to be things like dental. It's going to be things like vision. It's going to be things like pharmaceuticals. That's going to be the pieces that are going to end up getting cut first. So if you believe in what we're doing, if you want to lock that up so that you can see health and homelessness and how we actually marry those and save the system money, then you want to vote yes.
So, and I think this isn't necessarily a partisan argument. If you have Senator Jackie Winters and Senator Alan DeBoer, Senator Ferrioli, that are supportive of this, it is because for them, where they believe in smaller, limited, more effective government, the bottom line is that we should be using our dollars in the most cost-effective way possible, that has the healthiest population, that also ensures that people are a part of being responsible for their health care, for their health, right? Which means they have access to programs that allow them to have jobs and then work their way off of Medicaid, which is exactly what we want to see.
Got a question back here before we get to you, sir.
Hi, I'm Kellyanne Stiles. Oops, sorry. I'm currently on disability for fibromyalgia, and so I've been there before we had the wraparound services, and it was very difficult trying to be a single parent raising a child and working, and now I'm blessed to have the full disability. But I want to encourage people to support this, because there's a lot of children out there who are victims, and my daughter and grandson are victims of sex trafficking, extreme domestic violence, and many times they don't have the ability or the courage to go and speak up about it. So when we vote yes on 101, we're helping the vulnerable population of children and victims to get some kind of services to help them rebuild their lives. So I would appreciate if you'd consider that.
Sure, if you have the microphone, it's all you.
One of the arguments against 101 is that due to Secretary of State Richardson's audit, we won't need as much money for Medicaid because so many people are on, well, okay, some people are on it, you know what I'm trying, not illegally, but unjustifiably, and so I'd like to hear some response to that.
Yeah, that is an excellent and really important question. So with Medicaid, just like in your normal insurance plans, although a little bit different, there's a certain criteria for who is eligible for services, right? Who's eligible, and it's this population that comes in and out of eligibility. Sometimes people die, sometimes they start making more money, sometimes they move, and it takes a bit of time to track all of that. We have 1 million people that are covered by OHP. So when you look at and every independent analysis, even the Oregonian has said, although not in their editorializing, but they've said in their stories that our percentage of people who are covered that shouldn't be, that population is significantly lower than what the average is and what is expected, and we're well within the percentage, the margins that every other state is. It's just when you have 1 million people, you can't keep on top of things right away. It's not like you're going to find that right away. It may take a few months. So there is going to be a little bit of there will be some overpays, but in terms of being able to get that money back, that's not quite realistic. And again, I think you could probably be more eloquent.
Oh, no. So I think what's really, really important here to understand is the way that these enrollment issues, there are people coming and going on a consistent basis. But what we've done in the state of Oregon, and this is Medicaid across America, is you don't want to ever deny health care to somebody wrongly. So we always err on the side of, okay, let's make sure that this person gets coverage, gets health care until we've deemed they are no longer covered. And so there was a little bit of a delay, and that's what Secretary of State Richardson keeps saying is the mistake, is that there was a delay. That is very, very common. He's been explained to this myriad of times. The federal government is absolutely fine with it. This is not an issue. So that's, I think, one of those things where we as the state, can we do better? Absolutely. Are we excited to do better? Yes, I am. I want to be able to make it happen. But is it outside of the norm? Is there something nefarious here? No, not at all.
Hi, I'm Laura Parrish from Eugene. First of all, I just want to say thank you so much to both of you for bringing so much clarity to this issue. I've already voted, and you validated my decision. So, I was just curious, on a how can we help kind of a level. Josh, is your PowerPoint available? Is that something that you can share?
Sure, I'll send it to Linda, and we'll go from there. So
okay. And secondly, both of you. How can we help? I've actually gone online and found it difficult to get specific information about helping out with canvassing or telephone banks or in any other way. So I'd appreciate your suggestions.
See me afterwards, and what is the website?
Yesforhealthcare.org. They have sites. They should have canvases up and listed. The one other thing I will say that you could be incredibly helpful is just start the conversation and explain what a yes vote and a no vote does. I think that there's still sometimes some confusion around that. And if you just say, hey, please vote, which all of you are going to do, and you're probably going to tell everybody, and just explain to people a yes vote it maintains what we've done. It's the safe vote. No will create a great deal of chaos. I think that getting that message out to your friends, your family, is probably the number one thing that you can do to help. But volunteering is also the second and really, really important.
Yeah. And just talk to your friends. You would be surprised at how many people who tend to vote in normal primary and general elections aren't planning to vote in this election, or aren't going to vote. So talking to everyone to ask them to vote is critical. But yes for health care, and there's information listed about how you can help.
Facebook as well. They have a really good Facebook page.
No, 2 more. 1 week and a half.
11 days.
11 days, yes.
Okay, I joined the previous speaker in also thanking you for the presentation. While I've been totally supportive of the goals and aims of this measure, I've been very confused about how it was going to work and how it was going to achieve those goals, and that was important to my casting an intelligent vote, frankly. But I have, at the risk of abusing my airtime, I actually have 2 things I wanted to ask. One's a clarification, and then there's a totally unrelated question. Josh, in your presentation, you were explaining the deficit that led to the measure, and you talked about 2 populations that had different levels of federal support, neither of them 100%. But you also talked about a bucket that was lost because of the loss of 100% federal reimbursement, and I didn't catch what that 100% reimbursement covered.
So in the original, when the ACA came into place, so as an encouragement to states to expand their Medicaid population and to be able to take on that really difficult population, or unknown population, it wasn't that difficult, it was just an unknown population, the federal government said, hey, states, for the first 5 years, we're going to pay 100% of the tab. I'm sorry, for the first 3 years, we'll pay 100% of the tab for that population. So for if you're making 100 to 138% of poverty, we'll pay for it. And then as time goes along, we're going to start making the states pick up some of that money. And so the drop went from 100%, and it will go down to 90%. They pay 90% in 2021. And so it's just ratcheting down right now as we kind of go through that time. It's still a great deal. I don't know about you guys, but I would gladly take a 900% return on investment any day of the week. So it's still a really good deal, but it creates that budget hole.
Yeah, and I think one of the other things is they paid 100% for the expansion population, 100 to 135% of the poverty level, which again is like 32 or 34,000 for a family of 4. So they're not wealthy people, but picking up that population, they're an undoctored population, and I know Cascade Health, when they started outreaching to this population, they found that like 72% of the people that came in to see them, so these are working people that have been undoctored for a long time, had they either had hypertension, or they had diabetes, or they were pre-diabetic, or so when they said that they would cover 100% for this population, it was because it was not a healthy population. So as those people started to get into the healthcare system, started to be able to be healthier, get back to work, the federal government is ratcheting down what they're matching because we are able to lower healthcare costs for that population as they're able to get their primary care. And for some people, their primary care is South Lane Mental Health. That is the place that they get their primary care because that's their primary health issue. For some people, it's, your normal primary care doctor. For other people, it's, Planned Parenthood. It's, wherever your primary care. And the key is having a primary care medical home that fits for what your health care needs are. But anyway, that's why the federal government ratchets it down.
Okay, so my question goes back to the 1.5% on the insurance premiums, and thank you for explaining how it's going to leverage federal dollars, help you pay for reinsurance, stabilize premium costs. I get all that, but it also allows insurance companies to recover that 1.5% by upping their own premiums, and I'm wondering how and why it was felt that was necessary. So the insurance companies, one of the arguments you hear against this measure is that it doesn't put any of the burden on the institutions that benefit, like the insurance companies, because if they can recover that 1.5%, they're not out anything. So how would this work if you didn't allow insurance companies to pass that extra cost back to premium payers?
So I think there's 2 things. One is, we wanted to get people to the table to raise between $300 and $330,000 million, sorry, why did I say thousand? $330 million that we use to leverage another $700 million from the federal government. So what we said to them was, here, allow us to do this. And we said you cannot raise premiums because of this more than 1.5%. So yes, they're getting that back, and then we're getting to use that money to bring in another $700 to $770 million. So I wasn't in the room making that particular, in that particular negotiation, but that was negotiated. And it seemed like a good deal. The other thing is that because of the reinsurance program that we're using, it will allow us to reduce costs. And again, the average cost that independent analysts have said that they anticipate is that we will see a 6% reduction in those plans, commercial plans, self-insured plans. So that's $300 per person. So even if they, so that should balance out. But
6% before or after the 1.5 increase?
That would be after. That would be after.
Question here and one in the middle.
Thank you for clarifying this to the extent that you have. I am so sick and tired of buckets and exchanges and qualifications and hoops that people have to run through. So I understand this much better now, thanks to both of you. My only question is, are we going to be back here in 2 years or 3 years or 5 years trying to fix this again? And I don't know if anyone in this room can answer that, but what's your opinion? Where do you see this going? Will it hold?
So this is a 2-year, this funds the 2017 through 2019 budget. And these monies will go into funding services for the Oregon Healthcare Plan population. So in 2 years, we have 2 years to come up with a different funding mechanism. We have to see what's going to happen at the national level, what's going to happen in Oregon, what can we do to actually address the situation and let people get the access that they need. So will we be doing this again? I don't know. We've relied on this type of hospital provider tax or assessment since 2004. In 2009, we used it to cover all kids, so 100% of our children in Lane County in 2009. In 2013, I was part of the group that helped negotiate the hospital provider tax then. Will we use this assessment again? I don't know. It brings in a lot more money. I don't know that it will look the same, but we at least have 2 years to work together to find another bipartisan agreement to make sure that we're funding the health care that we need.
Thank you. Thank you for your wonderful presentation and so clear. I had a question based upon the passage of this, and I noticed in there that there's coverage for dental and vision and medical. I wondered if there's ever been any talk of coverage for audiological and hearing needs of patients.
I think it is. I know in some cases there are definitely coverage for around that. Particularly kids, that's a huge piece of it. But I'm pretty sure that we actually do include that inside of the package. I just didn't list it as part of it.
I think that there is access, especially for children, for audiological care. But and I'm sure many people here know, hearing aids are super expensive, and they aren't necessarily covered. And if you have a child who loses their hearing aids, my goddaughter is hard of hearing, and boy, she lost her hearing aids once, and they're really, really expensive, and they're not things that are generally covered. So it's hard. I think that we can do better. I think we should do better. If people can't hear, they can't participate. It's the same as teeth. If you don't have all your teeth, you can't live a healthy lifestyle. It's just one of those things. Yeah, they do. I know, and again, I'm with you. It's a critical need.
Thanks. Okay. By the way, thank you all for letting non-League of Women voters come today. I appreciate that very much. So, regarding that gentleman's question about the insurance companies are allowed to get it back, are the other players not allowed to get it back? Doctors, hospitals, they can't raise their fees or rates because of this, or they get it back too?
So what, so it's complicated. So previously with the hospital provider tax, that money would go directly, all of that money would go directly back to the hospitals. What they have said this time is that we can keep that money, so that some of it, most of it, so that we can then match it with federal dollars that will go into care, because what hospitals know, what doctors know, is that we have reduced the amount of uninsured, uncovered emergency room visits, and reduced a lot of the need for the charity care that, again, all of us with private health care plans covered previously. So they know that it will go back into care. And just one of the other arguments is that, well, this money, how do we know where it's going to go? So basically, you know, the revenues from the 0.7% tax on hospitals that isn't going back to hospitals like it was in previous years. The 0.7% tax on hospitals is the same as for the 5.3% hospital assessment. And in Section 8, Chapter 736 of Oregon Laws 2003 puts both assessments on hospitals, so what this is, the reimbursable assessment and the 0.7% tax into the Hospital Quality Assurance Fund. In Section 9, Chapter 736, it authorizes the state to spend monies in the Hospital Quality Assurance Fund only to 1, provide health care through medical assistance programs, 2, reduce the cost and improve the quality of care provided through medical assistance programs, and 3, pay the cost of administering medical assistance programs. So that money they feel confident in letting the state have that money because it has to go into care, which again helps their patients.
And it's really basic. The federal government is not going to send us the matching dollars if we don't spend it on healthcare. It's that simple.
Yeah, that's true.
Okay, last question.
Okay, I'm sorry if you've already covered this and I missed it. Is Cover All Kids separate from Medicaid? And are the Measure 101 funds dedicated or designated to cover only Medicaid programs?
Josh, you're the guy.
Yes and yes.
Thank you. Let's thank Josh and Val for doing this. I have just a little gift from the league. Oh,
Just what I need, more chocolate. Thank you, guys.
And I have to grab my announcement sheet. Hold on. So on your table, and we have a few more of these, this is an infographic that was prepared by the State League of Women Voters, which is an explanation of Ballot Measure 101. You can take it to your coffee groups. You can download it from the State League website, LWVOR.org. But anyway, feel free to take these with you if you can find a use for them. So also, then I want to remind you that there's a basket in the back as you go out the door that you can drop your name tag in, and that way it'll be ready for you next time that you come. And to remind you that there's a donation receipt bin there on the corner of the table if you bought fruit for Food for Lane County last month. And our speaker next month, I think, is going to be someone who's going to speak to us about autism. And then I think that's it for today. So thank you very much. Thank you to our guests for coming.